Today, we are going to review a broad history of the national health movement for peers. It is important to understand where we came from and what people had to endure before the system was improved.
Let's start by reviewing what happened on a national level. In the 1840s, an activist by the name of Dorothea Dix lobbied for better living conditions for the mentally ill after witnessing the dangerous and unhealthy conditions in which many patients lived. Over a 40-year period, Dorothea Dix successfully persuaded the U.S. government to fund the building of 32 state psychiatric hospitals. Next came a man called Clifford Beers, who was the founder of the mental hygiene movement, one of the earliest client advocate health reform movements in the U.S. Mr. Beers was institutionalized for 3 years, but later wrote a book called A Mind That Found Itself. He then founded the National Mental Health Association, now called Mental Health America. Mr. Beers dedicated his life to speaking about the abuses in asylums and lack of effective treatment. In the 1940s, more people began to form coalitions, and in 1949, the National Institute of Mental Health was created. And in the 1950s, antipsychotic drugs were developed, along with social programs such as SSI, Supplemental Security Income, and SSDI, Social Security Disability Insurance, began. Once a variety of antipsychotic drugs were developed, a push for deinstitutionalization and outpatient treatment began in many countries. Let's hear more about deinstitutionalization and what came to follow.
Deinstitutionalization efforts have reflected a largely international movement to reform the asylum-based mental health care system and move toward community-oriented care, based on the belief that individuals would have a higher quality of life if treated in their communities. The closure of state psychiatric hospitals in the United States was codified by the Community Mental Health Centers Act of 1963. And strict standards were passed so that only individuals who posed an imminent danger to themselves or someone else could be committed to state psychiatric hospitals. Peer support surfaced again in 1965. While the mental health profession was slow on the uptake of peer support, the philosophy was rapidly and widely adopted by the community of mental health peers. The mental health peer survivor movement has been a driving force behind the dissemination, adoption, popularization, and growth of peer support. In the 1970s, big state hospitals across the country were being closed down, releasing patients with severe mental illnesses into the community with inadequate transitional support. In 1992, the Substance Abuse and Mental Health Services Administration was created. With this came funding for consumer technical assistance centers. Finally, by the year 2000, the number of state psychiatric hospital beds per 100,000 people was 22, down from 339 in 1955.
Now let's take a look at what was happening in Arizona. In 1980, Arizona's state legislature passed a law requiring that certain community services be provided to people that were diagnosed with a serious mental illness. In 1982, Chick Arnold, then Maricopa County Public Fiduciary, filed a lawsuit in Maricopa County Superior Court arguing that the state was not providing adequate services to individuals with a serious mental illness. The case became a class action suit inclusive of all adults with an SMI diagnosis in Maricopa County. In 1986, the Maricopa County Superior Court rules that the state is violating the law. The state appealed, and the legislature created the Division of Behavioral Health Services within the Arizona Department of Health Services. In 1989, the Arizona Supreme Court upholds the lower court's decision ordering ADHS to provide a unified system of care, and in 1991, ACCESS, the Arizona Healthcare Cost Containment System, adds mental health treatment to Medicaid services. The plaintiffs, ADHS, and ACCESS began to develop a blueprint for services. And finally, in May of 2012, Governor Jan Brewer, Chick Arnold, and others announced that an agreement had been reached, and in January of 2014, more than 30 years after the lawsuit was filed, the Arnold v. Sarn lawsuit is settled. The deal required expansion of housing, employment services, peer support services, and assertive community treatment. So where are we now? Peer support is offered in many states. Arizona is one of the few states that covers peer support, family support, and youth mentors as a Medicaid benefit. The offices of Individual and Family Affairs were developed and are required by all Medicaid plans. A large number of advocacy groups, coalitions, and committees exist to advocate for the needs of peers and family members. There is still a way to go, and the rest is up to us.